Welcome to this Elite Learning Podcast CE activity. Our goal is to bring you speakers, information, and ideas to educate and challenge you to grow. Get ready to listen, learn, and earn CE hours.
On November 6, 2025, the U.S. Department of Education released a proposed rule redefining which graduate programs qualify as professional degrees for federal student loan purposes. This change is part of the implementation of the One Big Beautiful Bill Act, signed into law in July of 2025. Here's what's changed. Under the proposed rule, students pursuing degrees classified as professional can borrow up to $50,000 annually with a lifetime cap of $200,000. Students in graduate programs not classified as professional can borrow $20,500 annually with a lifetime cap of $100,000. This policy could take place effective July 1st, 2026. Now, the Department of Education's proposal lists 11 fields that qualify as professional degrees: medicine, pharmacy, dentistry, optometry, law, veterinary medicine, osteopathic medicine, podiatry, chiropractic, theology, and clinical psychology. Notably absent from this list are several healthcare programs, nursing, including MSN and DNP programs, physician assistant studies, physical therapy, occupational therapy, social work, public health, audiology, and speech-language pathology. Now, this proposal has generated significant discussion among healthcare educators, professional organizations, policy analysts, and students. Different stakeholders have presented different interpretations of what this policy actually means and what its effect will be. To understand this issue, we need to look at several questions. What is the Department of Education's stated rationale? What does the data show about graduate healthcare education costs and student borrowing? What do workforce projections indicate? And what are the documented responses from various stakeholders? For the next hour, we're going to examine this policy from multiple angles using available data and documented perspectives. Whether you're a student, an educator, a healthcare professional, or someone interested in educational policy, this episode will provide you with the factual information you need to understand this issue. I'm Dr. Candace Pierce, and welcome to Reclassifying Healthcare Degrees, Understanding the Department of Education's Proposed Policy Change. Now, joining me for this discussion is the always informative Dr. Jay Stowe. He's a nurse and an attorney, and I always love having you here. Thank you for joining me, Jay.
Hey, thanks, Candace. I appreciate being here, especially on such a tumultuous topic. Hopefully we can provide a little clarity and a little guidance as to what is inbound for us in the future.
Absolutely. Now, Jay, before we get started, I want to state a very important disclaimer for this episode. Now, we know that this is a very feeling-inducing topic, and so this episode, I just want to say, we're here to provide an objective analysis of the U.S. Department of Education's proposed policy regarding this reclassification of healthcare degrees. So the information that is being presented is based on official documents, published data, and documented statements from multiple stakeholders as of this recording. Now, some very important context that I want to make sure that we understand as we go into this is that this policy is proposed, not final. That means the rulemaking process is ongoing and details may change before implementation. And this episode is educational, not advocacy. So we're just presenting documented facts and multiple perspectives. We are not endorsing a particular position. And then we know that policy discussions often generate strong reactions. And our goal is to provide accurate information as of today so you can form your own informed opinions. Now, if you're making decisions about your education or career based on this policy, consult your official sources, your institution's financial aid office, and qualified advisors for the most current information. We encourage you to review primary source documents from the Department of Education and professional organizations. Verify your information independently and participate in the public comment process if you choose. Okay, Jay, did I miss anything?
Said a lot in a short amount of time. I think
I
that
did.
we're going to do even more. So, no, I think there's a lot to this, and we'll cover a lot of things, but there's so much more that'll unfold before July of 2026. Be interesting to see what happens.
Absolutely. We might have to come together and be like, all right, here's our update on our update. So, all right, let's get started with really just trying to understand the policy mechanics. So, can you help us to understand the specific changes that came about with the One Big Beautiful Bill Act regarding student loans and what programs were eliminated or modified?
So, the One Big Beautiful Bill Act, in short, reclassified what is a professional label versus academic or graduate label. And they basically just put labels on different degrees. And what those labels in turn mean, it correlates to how much you can get from the federal government in student loans. So this bill outlined a number of programs within healthcare that said, you know what, you guys aren't considered professional for the label, and therefore you're not able to take out up to $50,000 a year. You're only able to take out $20,500, also with lifetime caps. So what it does is it essentially says, for example, as a nurse, it says, Jay, you can take $20,500 out this year and not up to 50. And so it impacts you. It basically cuts what you could take in half of previous programs. So, it's a pretty dramatic reduction. It's also a reduction in the lifetime limits as well. And so it's going to play an important factor if this proposal does actually pass on. Do you go to graduate school? Where you go to graduate school? How you approach graduate school? A lot of different questions. But really, the big Beautiful Bill Act has in it a proposal for the Department of Education to reduce the amount of funding they are giving for programs that are no longer classified as professional.
Now, I would hate to know what your amount of student loans would have been to become a nurse and an attorney. I feel like you probably hit your limit.
It's not pretty. It's not pretty. And I think that is, as we'll discuss a little bit later, I think that's one of the key impetus to this bill rolling out is how much student loans students actually end up with over time. It's really an impressive amount, especially in light of degrees that don't typically have a very high rate of income once you graduate.
True, right. Now, how does the Department of Education's proposed rule define professional degree, especially when we compare it to the previous regulatory definition from 1965?
So 1965, when Department of Education was basically created, it was actually the U.S. Office of Education. It was later changed to the U.S. Department of Education. 1965 created a definition of the term professional, and it defined it as a degree that signifies the completion of a program of professional study, meeting the minimum academic requirements for admission to a profession, licensed by a state or recognized professional authority. And it gave some outlines, right? And it gave proposed degrees. And many of those you mentioned earlier, MD, Doctor of Medical Doctor, Doctor of Medical Dentistry, Veterinary Medicine, Law. It gave a lot of those terms. What's really interesting is even in 1965, nursing was not mentioned specifically. So when we talk about specific careers, it wasn't mentioned. So, but it did have a three-word phrase in there that universities and colleges have really grabbed hold of, and it said not limited to in the list of professions. And based off of that phrase, we then interpreted, hey, nursing, social work, public health. These other areas, these other degrees fall into the professional definition. Well, fast forward to 2025, 1965, and we're essentially, in order to change the rule, you've got to redefine professional. And what they're redefining, the propose is completion of academic requirements needed to begin a practice in a profession. It requires skill beyond those of a bachelor's degree and generally involves professional licensure. And so basically what they're saying is, instead of completing a program and meeting minimum academic requirements, you've got to have skills that you've gained that generally involve professional licensure. So basically they're adding another layer to the definition and stating that because of this layer, we now can exclude certain degrees and include maybe and arguably just include those originally outlined in 1965. Right or wrong, that's the proposal.
So what is the criteria that we're looking at that includes versus excludes? I know that you mentioned a few things, but can you lay those specific criteria out for us?
So when you look at this proposed degree program and proposed definition, you're looking at skills beyond a bachelor's degree is what it is specifically laying out. Then it generally involves professional licensure. And you got to complete academic requirements needed to begin professional practice in profession. The difference is 1965 definition says you've got to complete a minimum academic requirements, whereas the new professional degree says you've got to complete an advanced or more beyond basically just a bachelor's, but it is needed to practice in a terminal degree. So what, to enter the field that you're in. So for example, if you're going after your MD, you want to be a doctor, right? A medical doctor. You've got to get your terminal degree, meaning you've got to become a medical doctor to practice, if that is your field of study. Not necessarily DOE, but we're just going to concentrate on MD. Nursing, you do not have to complete a doctorate of nursing to enter your field of practice. You can enter your field of practice in nursing with a bachelor's degree.
Associates.
Yeah, associate. Absolutely.
And some places, certificates, diplomas. Absolutely. I mean, not certificates, but diplomas.
Absolutely. Okay. Love those nurses. They're fantastic.
Yeah.
So what they're doing is they're basically saying, what is the barrier to entry? All right. Can you enter your field early on, or do you have to go all the way to the end? Another example is law degree. So you have to have undergraduate, you have to have a bachelor's undergraduate, then you have to do a 3-year course of study in law in order to get your Juris Doctor, which allows you, is a terminal degree, which allows you to go into practice. There is no associate legal degree. There's no associate medical degree. There's no beginning degree that you can stutter step on. So they're drawing kind of some fine lines here as to split some hairs, getting back to arguably that 1965 definition as it was intended and maybe not so clearly expressed. But it is going to have some effects down the road on what we see in the healthcare field.
Now, what is their stated rationale, like according to their official documents and their official statements, of why the Department of Education is narrowing this definition?
You know, the stated argument is the loan limits will drive down the cost of graduate programs. All right. It will also reduce the debt that students have to take out. All right. When you look at it, there's $1.7 trillion of student loan debt out there right now. It's really, for me, it's an unfathomable amount of money. That's just a tremendous amount. And roughly half of that is due to graduates. Okay. And the graduates on an annual basis are a very small percentage when we consider all the healthcare individuals that are in associate degree nursing programs, bachelor's nursing programs, your social work, your other healthcare programs that are not a master's or doctorate. So the argument is, how do we drive down those costs? And what this is we're putting it, arguably, you're putting a lot of students involved in between the federal government saying, hey, we've got to reduce college education, right? The price of it is skyrocketed. Since about 2007, basically the universities have had a blank check. If our tuition is X, you can apply for a federal student loan to get X. And so it has just been unfettered, and it has just it's just increased. And so what the federal government is trying to do is mandate an entity's what they can charge, right? So they don't have to pay as much in student loans. But how do you do that to private institutions, to institutions that you don't actually have corporate control over? So you've got to do that in a different fashion. And this is the way that they're doing that, or at least propose to do that. And I would tell you, kind of along those lines, something that's really interesting. I live in Alabama, and I live in a city. There are, it's a major college town. There's two really major college towns in the state of Alabama. There's over 30,000 students in school here. When you look at the in-state tuition for a college student versus out-of-state tuition, the in-state tuition for a graduate program is roughly $13,268 as of 2025. The out-of-state tuition per year
is ridiculous.
$35,972.
I don't understand.
Well, I'll tell you, this is really what it boils down to. So I did a little math, and I said, all right, how many students are in-state versus out-of-state? There's 53% of the students are in-state and 47% are out-of-state. Why is that? Why are more schools doing this? So I did the difference. Now, of course, this is just a very generalized math. And I said, if 100% of the students were in-state students, okay, that's never going to happen. But let's just say 100% were. That means this one university is bringing in annually on tuition alone $308 million more than it would have by just allowing in-state students. Yeah. So the universities have also found a way to increase revenue along the lines of increased student loan debt with a kind of an unchecked federal government saying, hey, if we raise it, students can borrow it. They can go get it. So it's really, again, this kind of approach and focus on colleges and universities. But guess who's stuck in the middle?
Right.
All of these students that are just trying to get their career and get ahead. So it's really interesting, kind of this interplay and how everybody's jockeying and how everybody kind of does this or that just to have a revenue or drive down.
I have a middle schooler who's currently a middle schooler who has her heart set on the college in your town. However, it will now be an out-of-state college for us. So just hearing, and the thing is she wants to go to nursing school. So of course I'm over here like, go get your associates. It's cheaper. Go work at a hospital that has loan repayment and let them pay for your bachelor's. Like, that's what I'm over here trying to push her towards. But, she's got her heart set on wanting that college experience, especially the one in your hometown that charges, $35,000 for. Whew, that's a lot.
It's going to be a heck of an experience that, and you look at that, a 4-year degree, if you're able to get out in 4 years, it's a tremendous amount, and you haven't paid for room and board. You haven't paid. You haven't paid for the first meal, the first book. You haven't paid for any of that. So it's just really, it's a tremendous expense for what we're getting in return. And I think that's really the issue. You can extrapolate that out. The first-time homebuyer this year raised 2 years. You're now 40 years old as the average first-time homebuyer.
Yeah.
If you have to wait 20 years after, 15 to 20 years after you graduate from college in order to buy a home, how are you going to get out from under student loans? It's just it's a question, and somebody's got to do something about it. And we may not all like the approach. And this may not, and what President Trump and the Department of Education have proposed may not be the end result. But I do applaud let's bring it to the table,
Right.
because we don't need 60-year-old nurses throwing a party saying, "Hey, I just got out of all my student loans."
Right.
That's not a life. That's not living. So we have to do something about it.
Absolutely. Now, according to the National Center for Education Statistics, what are the average annual costs for your master's and your doctorate programs, so your graduate programs across your different institution types? Because you've got public, you've got private, I'm sure there's other different institution types.
Absolutely. There's really three main institution types. You've got your public institutions, and you've got your private, for-profit and not-for-profit institutions. And when you look at master's and doctorate, it's relatively close on these programs. Public, we'll start with that, is roughly $10,000 to $15,000 a year. Okay, varies state by state, and again, this is average. I'm in Alabama. Theoretically, that's somewhat cheaper than, say, if we were going to compare it to California and New York. Okay, that's going to be vastly different. Which is ironic. When I worked in California some time ago, many of those nurses went to school in Kentucky and before transferring back to California because of the cost. They would actually move halfway across the country for several years to get their nursing degree before moving back to California to work. It's really amazing. But back to master's and doctorate. Your private for-profit is going to be more. It's approximately double. So when you look at public, about 10,000, your private for-profit is about 25,000. And then your private not-for-profit institutions is really up there. It's $40,000 to $50,000 to $60,000 a year. And so when you start capping someone at $20,500, what are we going to do to these small, historic, nonprofit private universities? It doesn't have to be historic. Let's just say small private universities. They're either going to have to reduce the price, then how do they operate? Because they don't have the revenue coming in. Or two, they're going to close down the programs. And so both of those are game changers. And if this proposed rule goes through, there's a good chance you'll see some of these universities that are just getting by really close down.
Now, I was able to get my doctorate, but I went through a private Christian school in Alabama. It was very expensive. However, the reason that I chose to go to that particular one is because they had federal grants that you could qualify for. So I was able to latch onto one of those federal grants, and then you had to work so many years, and every year they would decrease how much you owed by a certain amount. And then I ended up paying maybe like somewhere between $15,000 and $20,000 for my doctorate out of pocket. But it would have been probably quadruple that if I had not qualified for a federal grant. So it's crazy how much it goes.
And if you don't have the capacity to pay it back once you graduate, you think about nursing, and I'm sure we'll get there, but in this line of questioning and discussion, you think about, what if you're single? What if you're a single parent and you come out with this? What if you're a single parent of multiple children and you come out? You've been working for years. You go back to nursing. It's a great job. You come out. When you were working with a family, you took total loans. You had to. How do you survive doing that without it? So now, how do you afford your family and to do this on a salary where the only thing you can do is work overtime.
Yeah.
So then now you're not with your family. Now you're
No.
not here. And so it's we've got to approach the student loan issue somehow,
Yeah.
and we'll see where we go with it.
Especially because when you're talking about the average annual cost to go get a graduate program degree, and then you think about how much it actually really increases your pay, it's not by much. If you're still at the bedside, you want to be a bedside nurse, that's where your heart is, and you go to get a graduate degree, you're only really increasing your pay by a couple of dollars for each degree, if that much. I mean, at least that's what I've seen it. Am I interpreting that correctly?
No, you're correct. And that's one of the root stated causes of why this change has been proposed by the president and his team is students coming out are saddled with so much debt, can't pay it off. That's
Right.
when we think about this, we think about, it's been in the news lately, and they haven't done this yet, but it's they've proposed a 50-year home mortgage. It's because people can't afford home prices.
Yeah.
This same thing happened 50 years ago when they proposed a 30-year mortgage. But, 30-year mortgage wasn't always around. So now they're just kicking the can down the road and kind of repurposing it. So instead of just, increase the loan terms or what have you and create something, we got to look at the root cause, and that's the actual annual price. Now, if salaries go up, fantastic. Then now it's a whole different story, because then we can cover that as service. But right now it hasn't. And nursing is not it's a stable profession. It's a good profession. It's one where you can make a fine living, but it's not one where you're going to do exceedingly well and make a whole lot of money if you remain at the bedside.
Right. You're right. And we need them.
You'll always have a job. It'll be there. But it's going to be very difficult to pay off a lot of student loans.
Now, what's the federal data showing around current borrowing patterns among the graduate students? What percentage borrowed? How much do they typically borrow? How is this going to compare to those proposed caps currently?
So it looks like 69 to 70% of all students in healthcare are getting loans. Okay, and that's an average, right? That changes for demographics, but that's about 69 to 70% of all students are taking student loans. Very large percentage. Okay, let's be honest. 7 out of 10 people just to pay for student loans, and this is everybody. This is including undergraduate degrees as well. When you talk about graduate degrees, that number goes up because, again, think of the amount of money we're talking about beyond what you've either saved or can pay for early in your career. If you're doing a graduate degree, you've gotten a bachelor's degree, a 4-year degree of some type. I say some type. Physician assistants, at different programs doesn't necessarily have to be a nursing in order to advance.
Right.
So you've got a bachelor's degree. So you've got 4 years. Were you able to pay for all 4 years some other way, or do you have student loans then? Because when you get to master's degrees, if you were able to cover your undergrad, now the average student loan debt for graduate and master's degree, when you look at different things, public institution is stated to be anywhere from $49,000 to $69,000. A DNP graduate, doctor of nurse practice graduate, skyrockets. Okay, it's anywhere from $80,000 to $180,000.
Yeah,
and that makes sense when you consider that 7 years of school, upwards of private school. If it's $30,000 a year, 150, 180,000 is right in the ballpark, and that's tuition. Again, that's not room and board. You haven't put a gallon of gas in your car to drive to school. You haven't done any of these things. So the debt load for our graduate healthcare profession is exceedingly higher because you've been in school longer and you have less, and more people actually continue today than ever. So what I mean by continue is they do their undergrad and then they go straight into a graduate program. So they don't have 3 years, 5 years to pay down their undergraduate loans first, or they don't have 35 years to save money in order to apply to their graduate program. So you're just stacking these student loans on top of each other year by year by year, and then delaying payments.
I came out with my bachelor's with a pretty good set of loans, but part of the issue for me was I had scholarships going into college, and then I had to let those scholarships go because I couldn't qualify for them anymore because I didn't have the time. Like, for example, I had a choir scholarship on top of a couple of others. But that meant that I actually had to go to choir and I had to sing and I had to do all these things. But when I started the actual nursing school part of my learning, my journey, they didn't give me the time to be able to go and do the things I needed to do in order to continue to qualify for these scholarships that I had. And that makes it really hard too, especially on students who rely on scholarships to go to school. So I ended up coming out with quite a bit of loans from my bachelor's in order to survive. Because, even in nursing school, it's hard to work. I worked weekends, weekend nights. I did the best I could do. But they didn't really give you a lot of time to be able to get the money you need to complete school. So it's hard.
Most programs are structured in a way that you're not able to. Not easily. I shouldn't say that.
Not easily. Yeah.
Easily. And it's a dissuasion because the schools want you to focus on the schoolwork and succeeding in their class. And I understand that standpoint. I want everybody to succeed. I want everybody to be the most knowledgeable they can coming out because one day you're going to be taking care of me, and I'd really like for you to be great at your job.
For real.
But the alternative is, when you look at this stuff, some people have to work.
Yeah.
You gotta keep the lights on. You gotta feed your child. You've got to do these things where it's going to be very, very difficult if you're not able.
And you end up capping out your student loans because you're getting that extra money every semester to be able to keep your lights on, to be able to keep yourself fed, or to take care of your family.
And the flip side of this is, let's say you max out your federal student loans. Now you're able to get private loans. Okay, let's say you're able to get that. You have a sense of comfort of, hey, I've got loans, I'm covered, I am good till I get out of school. Then all of a sudden, your first repayment notice comes in, and you realize your private student loan interest is on par with
much higher.
You may be 10% interest rate versus federal 5, 6, 7%. Well, oh my goodness. Think of how much more now you're repaying. It's astronomical. So now you're in a hole even deeper because you've got such higher rates of interest paying on these student loans.
Yeah. Now, I know the Department of Education had a statement that said approximately 95% of nursing students borrow under the loan limit. Does that actually align, or does it conflict with the data from nursing education organizations and institutions?
So I had to do some research on that. And it's not incredibly easy to parse that number out.
Yeah.
I will say that if you look at, I went in, I even looked at the latest data I could get was 2022, 2023. And I was looking at total undergraduate nursing. So even at that point, there's 276,000 students enrolled in BSN programs across the country.
Okay. Yeah.
About another 400,000 in ADN programs, in nursing specific. So at that point, about 43,000 were in graduate programs. So when you extrapolate out and you think of the percentage of graduate students versus quote unquote undergraduate students, you're looking at about 6-7%. So knowing that graduate students carry a much higher rate, 85+% of student loan debt, they all have, because you haven't had a chance to work. So the only thing you can do to complete is get more debt. So
Yeah.
it does comport with higher numbers of debt for especially those graduate programs. So when you look at entry into, say, the nursing field, most of them are able to get in under the student loan limits. Now, how is that going to change when we look at private schools going forward?
Mm-hmm.
I think that is going to be a question that really rears its head, because I think that's where some of these numbers are going to change. So it's difficult. It's difficult to really put a pen to paper on that 95%. I do think that's in the ballpark. Maybe a little high from what I can tell. But, if you are an individual that can change where you want to go and stay in state, go to a public institution, or for a 4-year degree, or if you want to start with an associate's degree and transfer, then I think you can. I think you can stay under those student loan limits that are proposed. And so it's going to be a change. It's going to be a change, though. It may not be exactly what you want to do, but I do think you can stay under those limits today.
Now, I want to look at the stakeholder perspectives, looking at, for example, what evidence and reasoning has the Department of Education really provided to support this policy change that they're going to push?
They really hamper, or they really put their hat on reducing student loan debts. And I think when you take a look at everything, you are really looking at some other things that are deeper than what is the stated reason. I think when you take a look at what's out there, you've really got to take a big picture. If you look at Social Security, for example, post 9/11, we had 73 million individuals drawing from Social Security. Now 69 million. It's a 4 million reduction. When you look at the population of the United States, it's really weird stuff. They have all these actuaries. They're brilliant people, way more brilliant than I. And they will tell you that you need a 2.1 per person birth rate to sustain the population. The U.S. front birth rate is 1.61. So that means that we have a declining population, right? We have a declining population. When you look at the number of nurses in the field, we have 3.4 million registered nurses right now. Only about 69,000 leave the workforce every year. So if those 2022, 2023 numbers are correct, okay, and we have 76,000 nurses in school, then we're replacing our nurses fairly well. In fact, we might be replacing them too well. And if we put too many more out there, we actually might be driving the cost of nursing down, the actual income afterwards, because man. So I think if you look at all of these things, the kind of unwritten thing and the kind of comments that you'll see frequently are, we're trying to address the 700,000 jobs that are open in the country. They didn't say healthcare jobs. So this is also a move by the government to say, hey, don't go into healthcare. Go take one of these other jobs. We're trying to shift manufacturing back to the United States. So I need you to go take one of these other jobs. Don't worry about healthcare, because we're going to make it a little bit harder for you to actually go and get this degree. We have our stated goals, and they're very altruistic. We want to help you. We don't want you to come saddled with debt. But we may not need that many nurses, and we need these other manufacturing jobs filled. So it's very not very forthcoming. But when you take a look at a lot of the bigger pictures and these other data points, I think the government has many more reasons than what they put on in their statements as to why they are making these changes, and now especially. we hadn't even talked about AI. But what does AI
No.
do to the nursing field?
Oh, yeah,
I
what's
mean,
it already doing to the nursing field? Yes, I've had some podcasts on that. Probably continue because it's continually evolving.
yeah.
But I really like what you were saying about how do we really have a nursing shortage? Because you constantly hear we have a nursing shortage, we have a nursing shortage. But really, we have a management leadership problem. Is really what we have that then drives our nurses, especially our new nurses within the first year of being at the bedside, away from nursing or away from the bedside. And that's a really big, because you're right. If you look at the numbers of how many nurses are that graduate every semester, every semester we're graduating nurses. Yes, we have many people that don't get into the nursing program, but every semester we are graduating quite a few nurses nationally. And yes, you're right. I love how you so eloquently discuss that. Now I want to ask you about the response to claims that this particular policy is going to reduce access to healthcare. Now, you talked about how, we still have nurses coming through, but now maybe it's going to be a little bit harder for you to get into healthcare. But what about reducing the access to healthcare, education in general, which again is going to reduce access to healthcare?
Well, I think it's a very valid argument. I think it's very valid.
Mm-hmm.
You look at currently, and this is this is the interesting things about even laws and bills and different things that are passed. When you pass them, they look great, and they may look great for 2 to 3 years. Like, hey, look what it's doing. We stop talking about them, and then 10 years later, we say we've got a crisis. We have to do something about it. And so when you look at the number of nursing students in the field of nursing, if we were to pass this proposal right now that says, hey, we're going to slice and cut in half how much you're able to take loans on graduate degrees. You're arguing, first of all, it's not going to start till July 1st of 2026. It will not affect those that are enrolled in programs. So you arguably aren't going to feel anything for several years, like a shortage. But what you will feel down the road is, one, if it doesn't actually drive down the cost of these programs to colleges and universities, which, I don't know how profitable some of these universities are, but many of them are not super profitable, so they rely on this revenue. So how far can it actually go down? But if it doesn't drive down the cost of these programs, then you're going to start looking at a lack of individuals that can go into the graduate program. Or do schools in turn say, our doctorate program that used to be a year long is now going to be a 3-year program so that you can work and go to school at the same time. We're doing this for you so you can support your family. But now I can charge you as much or more over 3 years to still be under the annual student loan limit. I see a lot of that coming down the pipeline. So at the end of the day, if it doesn't reduce the cost of the program, it may actually increase the amount of student loans that you face. So again,
it could go either way.
Like we said when we first started, I appreciate the first stab at this discussion of how to approach this because we are coming out with way too many student loan debts as a society. But how do you fix that?
Right. Now we've got a lot of other stakeholder perspectives coming out. You've got the American Nurses Association, American Association of Colleges of Nursing, other healthcare organizations that are documenting official responses and outlining different like nursing faculty shortages, qualified applicant rejection rates, which it's all true. We do have all of those things, enrollment projections. Now, how do we interpret the data that they're putting out, the information that they're putting out?
I think one of the best ways to evaluate what is out there is some data that I stumbled across. Is
Oh,
I know, I'll tell you.
I
But
can't wait to
basically,
hear it.
yes, it basically says how many students were rejected from schools. We can estimate. I've seen figures where people say, "Oh, there's 1,000,000 for nursing position shortage in the U.S." We have the 4.3 million licensed nurses, and 3.4 actually are employed. Well, I know a lot of nurses that are retired, but they've worked their entire career and they're not letting their nursing license lapse. Right? They're going to have an active license on the books, but they're not working.
Right.
So 3.4 million, when you say a 1.4 million shortage, I just have a hard time with the validity of that. That means we're 30% short, and I think we would hear that on the news daily if that was the case. What I think is important is to take a look at our students and then take a look at where we are as a shortfall. And so when you look at this on nursing faculty positions in 2024, 2025, it looked like from American Association of College of Nursing, there was 1,977 full-time nursing faculty vacancies, less than 2,000. It's a lot. Okay, when you talk about how many each facility actually employs to teach students. But when you hear this massive shortage, less than 2,000, maybe it's palatable. I don't know. It's roughly about 7.8% of postings that are open.
Okay.
Trend over time, it varies between 1,300 and 2,000. So about 80% of those do require a doctorate degree. So it kind of goes back to one of our discussion points of if it's harder to get a doctorate degree, can we fill those?
Right.
So one number to follow as we go forward annually is, what does that number look like? Does that open vacancy in teaching positions go to 2,200, 2,500, 3,000? Do we track that, and then we'll get a better idea? When you look at actual students that are turned away each year, I had this number. You're looking at about 40,000 to 50,000 students that are not accepted into school annually.
Sounds about right.
So when you look at that number across the entire U.S., across nursing programs, is that a lot? I don't know. I don't know if that's a lot. I don't feel that it's a lot when we talk about we've got almost 300,000 students in baccalaureate programs, 400,000 in associate programs, associate degree nursing programs. Doesn't mean those individuals don't go back to school, get some up their GPA, whatever the thing may be, and apply. So I think that access is there. Do educators, which are required the graduate degrees that this new proposal is going to limit, will that play a part in this? I think it will. I think right now it doesn't feel impactful, but I think that's something that we have to track and monitor as we go along, because I think if that number grows, then we could definitely
headed in the wrong direction.
Definitely see some issues 2, 3, 5 years down the road.
Right. So what they're saying, really, there is some validity to what they are putting out there.
I do think so.
Yeah.
I think there's, it's a kick in the pants when somebody classifies your degree as not professional.
Right.
When you go through what nurses and other programs do to get out there to work the hours that they work for the pay that they earn, trying to help people get better, it is a kick in the pants. But you know what? We can get past that. I can get past that at the end of the day if I'm doing good work. Yeah. But then if you're not able to pay for the work that you're doing, as the student loan rates are so high, it's very difficult. Then you're looking at a lot of other things. you're looking at access to healthcare and who can get access to it. I mean, these programs that are being looked at, 70 to 85% of them are comprised of female individuals. So are we disproportionately saying, hey, females, you can't go to graduate programs? I don't know the answer to that, but it's an argument that seems pretty valid when such a large percentage of this field is consumed of females with these programs, these degrees. You can break that down even further when you talk about Black or African American and Hispanic and Latino populations. This is many of these individuals get into healthcare because it's a first opportunity, and they disproportionately carry higher student loan rates because they have very little to begin with. So when you look at average student loan rates, these populations carry a higher one. So not only are we telling these individuals, you got to choose different routes to try to get your degree. Now we're saying, hey, you need more student loans from day one versus other populations, and we're not going to give that to you on day one. We're just going to limit it to you. So do these populations go through school longer? Do they have to drag things out in order to get their whole school paid for instead of 4 years? Do they need to go 6 years before they go to graduate? It's just, I don't know the answers, but I think the questions are there, and are we disproportionately affecting one population, either unbeknownst or we know it. I don't know what the federal government knows, but are we disproportionately affecting a population from advancing in their careers? And I think there's a very big argument to say that, yes, we are.
And I think one of the things, too, that you just kind of brushed over just now, but when it comes to your advanced practice, even, we talk about advanced practice nurses, but also PAs are on this list. And a lot of times those who are in these roles are serving underserved areas and bringing healthcare to basically like healthcare deserts. And how is this going to potentially affect these areas?
It's across the board. We look at it from the NP and the PA kind of standpoint, but your public health workers, your social workers, those individuals that are the front line going into people's homes or going into the community. What if they're not there? What if we start seeing a dramatic decrease in those individuals? When you look at PAs and nurse practitioners, they've all but taken over urgent care clinics across this country.
Yeah.
Anywhere I live, there's a shortage of physicians. I can get in to see my primary for wellness checks or annual visit. But if I'm sick, I go to an urgent care so I can actually be seen within 6 weeks to get whatever I need to get better.
Right.
I can't get an appointment at my primary. There's a big argument of why I even need a primary, right? So you look at that, and this is a decent sized city. I would not even call this a healthcare desert. So when you actually go into the rural communities and we don't have individuals, NPs, PAs, social workers, masters of public health, going out there, it arguably has a very dramatic and costly effect to our population as a whole on the healthcare that they are able to access. Little things. Your master's in audiology. School system's going to be able to provide hearing exams now in 5-10 years. These are little things that we don't even really think. I mean, it's just a blip on the radar of this we don't think of. But if we don't get these students out there, do the children in these rural areas, inner cities areas, do they get the hearing equipment that they need in order to actually perform well in school, to even get to the point where they can go to college?
Right.
There's a very big step to a lot of these things, and it's affecting the front line of our country. And you know how big it affects it? I don't know. But if this goes through, we're definitely going to see in 3 to 5 years exactly what kind of impact it has.
Very true. The last thing that I want to talk about is the rulemaking process and the timeline. What is the federal rulemaking process for this, and what opportunities actually exist for public comment and input before this rule is finalized?
So this proposal is a proposal, and it's kind of I think it's like a lot of things that the government does. They float possibilities out there in the news and in the media, and then they kind of hear the feedback, and then they act as per the feedback, yay or nay, most times. So this will actually take a rule and a law. It's actually take a law to make this change permanent. So an executive order cannot change this. Now, it can disrupt the fire out of the process if we do an executive, and I say we, if the government does an executive order, then it will go to the courts and it'll all get turned, and then it'll get overturned in time. But who knows? It may take a year before that's figured out. So what's more likely to happen is it does need an actual law to change the definitions to make this proposal codified. So what will happen first of the year is there will come out a period, and the government will make an announcement that, hey, we want to receive any feedback, comments on this proposal. It'll be a formal collection period. I would look for that. I would look for whatever organizations you're a member of, American Nurses Association, American Social Workers Association, Public Health, Audiology Association, PA, NP, all of these programs that are affected. Speech language pathology is affected.
They're all being very vocal right now too. So if you're,
and they're getting which they need to be. You know,
right.
whatever their position is, I encourage everybody to advocate for your belief. So there will be a collection period, and you'll need to advocate. The other thing I would suggest is advocating to your senators, because that's who's going to ultimately vote on this. They need a majority, so they need a 60 vote to pass. That has right now, with the contentious nature of our legislators, that's going to be difficult. Doesn't mean it's not possible. Okay, you never know what gamesmanship is going on. So you'll need to be vocal, and then it will go up for a vote. And if it's passed, it will be in effect July 1st of 2026. So, you know, when you get that notice, or you hear an announcement, or I would suspect many of your licensing entities will notify you, hey, speak up. You'll get an email, get a letter, something that says, hey, speak up, call your people. They may even provide you with contact information for those individuals. And you'll need to actually evaluate whether or not you want to do that. But you got to really research. I encourage you to do the research on your own. If you are going back to graduate school, I encourage you to look at that, crush the numbers, and see if it's even possible for you. Does the proposal, is it reasonable? Is it not reasonable? Can you do it? If you can't do it yourself, then I guess you know which way you need to argue and which way you need to have the conversation with your senator.
Right, absolutely. Now, my last question for you. I know that there's a lot of feelings over the term professional degree and removing people from being considered a professional degree. But does that, what does that really mean in terms of our profession? I mean, does it change the fact that we are professionals in our career? And, you know, what are your legalese thoughts on that?
You know, the one thing I've learned in law and even in medicine is there are definitions for words to meet certain criteria. The definitions are really irrelevant outside of that criteria. This definition, the proposed change, is simply for student loan amounts. All right? Doesn't mean you're not a professional. If you're not a professional, and I'll take my profession in nursing, then you don't need to be in nursing. All right? Being a professional is not necessarily a label. It is how you act, how you hold yourself, and how you care for the patients that you see. If you can't do that at the standard, then you don't need to be in the profession to begin with. So for this proposal, it's simply a label in order to reduce the actual student loan amounts. Now, that's my opinion. Other people take it a little bit more serious and saying that you're taking the professional label off the nursing. I don't think so. I'm still a firm believer that the reason you go to a hospital is for 24-hour nursing care, because the doctor just drops in and only knows what I tell him. So
yes, you're not wrong.
So you come to the hospital because you're really sick, and I'm there to help you. And so because of that, I still think that nurses are professional, and it is something that we always strive to be daily. And different times in your life, you'll have different words that have different criteria that will apply in different situations, but nursing will always be a profession.
Absolutely. I really appreciate what you just said. Well, we are at the end of our time together. Thank you, Jay, for being here. It's always a pleasure to learn from you. And I really appreciate all the data and all the research you do before you come to do this podcast with me.
Hey, excited to be here. It's always interesting, ever-changing world, and you never know what will happen next. But we'll
see. Absolutely. Now, to wrap this up, I just want to emphasize some key facts that Jay discussed with us. So, Jay, if I get any of these wrong, please butt in, okay? So the Department of Education's proposed reclassification of healthcare degrees for student loan purposes is currently in the rulemaking process. And that's as of this recording, December of 2025. The rule has not been finalized. The policy would start July 1st, 2026, if the rule is finalized as proposed, meaning students in graduate healthcare programs not classified as professional degrees will face lower annual and lifetime borrowing limits for federal student loans. Now, the positions. The Department of Education states this definition aligns with historical regulatory precedent and that most nursing students will not be affected. Healthcare professional organizations state this will restrict access to education and worsen workforce shortages. The data. Graduate healthcare education costs are varying, and it varies widely by institution and by program type. So your student borrowing patterns also vary, with some students borrowing below the proposed caps and others requiring higher amounts. Now, the timeline. The Department of Education expects to release these final rules by spring of 2026 at the latest. Public comment periods and negotiated rulemaking sessions are a part of this process, as Jay mentioned, so make sure you're watching for this so that you can be a part of it if you want to. Now, there is uncertainty. The long-term effects of this policy on enrollment, workforce supply, and healthcare access cannot be fully known unless this policy is implemented and the data is collected over that time. So whether this policy change will have minimal impact or significant consequences really depends on multiple factors that different stakeholders assess differently based on available data and projections. Did I get all that right?
Sounds great.
All right. Well, thank you for joining me for Reclassifying Healthcare Degrees, Understanding the Department of Education's Proposed Policy Change. Hopefully, we presented the available facts and documented perspectives. How you interpret this information, though, and what actions you take, if you so choose to take any actions, are your decisions. And I hope that you will base that on your own analysis and your own values. But I do encourage you to explore many of the courses that we have available on elitelearning.com to help you continue to grow in your careers and earn CEs.
Thank you for listening to and learning from this podcast CE activity. Did you know that you can listen, subscribe, and share Elite Learning podcasts on podcast platforms like Apple, Spotify, and Google? Subscribe on your favorite podcast platform today and never miss a new episode. To earn your certificate, follow the prompts to complete the CE activity.